Thanks, Lauren. Okay, how's that, Lauren?
Perfect.
Great, thanks so much. Okay, so joining me today, we have Lauren and me from DESE, Ross, Eliza, and Michael from the Shah Foundation, Elizabeth, Jeremiah, and Sean from our COVID Command Center. And really glad to just be here with you today. What we want to talk about today, just working through some questions and challenges with implementation. Consent is a big issue, so we'll talk about that a little bit further. Some policy updates, please pay close attention to that section because there are some really important policy updates that I think help to facilitate the implementation of our pooled testing initiative. We're going to have an update from our colleagues at the Shah Foundation, particularly Eliza Novick will be joining us around best practices and resources, and then our next steps as well at the very end. I'll come back and talk about some next steps. So with that in mind, let's just jump right to the content and dive in. So we're hearing about some questions, some challenges relating to implementation. So we want to just bring you some of our ideas today. And so why don't we just kick things off about just that matching process with vendors. Many of you, I'm sure, in this meeting have already been matched, but we just want to make sure that we go back over this with you, any of you who are newer to the early launch. Just a reminder that we're really working to make those matches within 1 to 2 business days. And what happens is when we receive your application, we try to sort of batch it together with several others just to see how many we have coming in during that day, for example, so that then we can decide how many go to which vendor. And so, we kind of batch them at first and then get them out to our vendors. So within that kind of 24 to 36 business hours, we contact our vendors and then they have 24 hours to approve the match. So that's why it's taking, sometimes that moves very quickly. Sometimes it's just a little slower as we kind of look to see how many districts have come in during a 24-hour period. And then once the vendors approve the match, which we really appreciate how quickly they're doing, we notify you. Lauren Wu does that. You get an email from her and the vendor then reaches out to start that contact and start the process with the district. And I hope many of you have sort of gone through this process. And for any of you who are new, just know that that we're really working to get this done as quickly as we can. One thing that is slowing us down is if you're not providing us with complete information, then we are sometimes having to go back to districts to help with that matching process, to get more information. And just if you have any concerns, don't hesitate to reach out to that email address. We monitor it really closely, and Lauren gets back to people really quickly too with your concerns and questions. So just moving on from that to the parent engagement. And I just think this is really critical. And I know Eliza is going to go into this further in terms of resources that the Shah Foundation has gathered that we want to be able to share with you. But just to start with, we do have the parent letter that's available. Just want to remind you of that on our website so that you're able to modify that as necessary. And some of the feedback, frankly, that we're getting here at DESE is that people appreciate the letter that we're providing, but it might be good to kind of customize what does pooled testing mean for your specific location. What does it mean for your district or your school? And particularly that middle bullet that we have in there, kind of why is this a valuable option for the district and the school, I think really needs to kind of be personalized and communicated to parents, hopefully from the district directly. So for example, if you are an all remote district right now, but you have plans for reopening, you can talk to families about how this is a critical element of your return to in-person learning. If you are, I think one of the key messages that I've been conveying is that it really helps us to understand the effectiveness of the existing mitigation strategies, hand washing, the face mask wearing, the physical distancing, staying home if you're sick. We know that those are the most effective practices that we have to have in place. And this just gives us good data about the effectiveness of those practices and the adjustments that we have to make. And, frankly, one of the, this is a nervous time everywhere, right? It's a nervous time for us, for you, for parents. And there is some nervousness that this could be used to, not have kids be in school, and maybe some reluctance from parents to sign up. And so we just want to help to convey that this, like, why are we doing this? How does this actually help to provide safe in-person learning options for students? is something that we think that in addition to what we've put in our letter, which sort of just explains pooled testing, there might need to be some messaging from you about kind of why should parents be excited about this? Why should they be invested in it? Just to continue to get that high rate of parent participation that we know is so necessary in order to make this work. And so, and it might not just be once, it might have to be on message several times to get this idea across of why pooled testing is safe, it's easy, it's gentle. I love the idea of, having parents just, take out a Q-tip at home and having the district encourage parents to just take a Q-tip at home and have a younger child maybe, rub it on their hand, and just to talk about, this is the type of thing that will be used in school to alleviate both parent and child concerns, again, so that we just get that high rate of engagement from our families as well. And so, just thinking about, the type of information that you're providing, making it, just clearly and concisely, and working towards, higher parent engagement, faster implementation is what I know we're all working towards. And I know Eliza is going to go into this further with some really good tips and ideas that they've been collecting from districts who really, obviously, you're all leading the way on this, and we're just trying to collect good information from you on how to make this happen. So just moving on, when I get control over my PowerPoint again. All right, here we go. Cool, there we go. And some of the logistical support that we want to just mention as well for today's meeting. And so we just want to make sure that if you need that tier 2 support, that additional support for on-site administration, on-site coordination, we just want to make sure that our vendors are providing that as quickly as possible. And just remember that, needing more logistical support could impact the timeline. This is human work. We've got to find the humans to come and do this. And so, if you have any concerns about that on-site support, please talk to your vendor or us, because we want to make sure we troubleshoot and keep these supports moving as quickly as we can. So just moving on from there to thinking about here's some good further logistical information about when to conduct pooled testing. And this is really coming from what we're hearing from the labs, because they have to process, and we're really hoping to increase the volume going to labs. And so we just want to make sure that we're thinking through, like, how can we help this happen as quickly as possible. So most common testing days right now appear to be Mondays and Thursdays. And so if everybody aligns on Mondays and Thursdays, it could take a little longer to get test results. And so, the earlier in the day, so if you are Mondays and Thursdays, just encouraging you to have it done and couriered as early in the day as possible so that the results can be available the next day, because we really want that information back quickly. But if it's at all possible or feasible, you might try to test on other days of the week. Tuesday, Wednesday, Friday could help to even out demand throughout the week. And then again, just like I said earlier, testing students earlier in the day will help as well. So just moving on to consent. Consent is a complicated issue. This is one where consent is continuing to be something that we have to problem solve around to make sure we're doing it well, to make sure that we're doing it, as each kind of step of pooled testing unfolds, consent changes slightly. And so I want to go to the last bullet first. This is a really important aha moment, and I'm just going to credit Superintendent Kuchenberger from Melrose, who shared this idea with me of really impressing upon families that they're going to need to provide consent likely on several occasions throughout the process. And that's okay, because, for example, some districts are, so working our way back up the points here on the slide, if you're getting started right now by having parents consent through your student information system or through some other online portal, but not the portal that the vendor uses, right? As Project Beacon, for example, becomes the portal that parents will get a link to, and they'll have to log into that link and put in their child's demographic information. At each step, they're going to be asked to consent again. So they need to consent if you're using your student information system, or if you're using a Google Doc to get information from parents right now to start your kind of early adoption of pooled testing, you might need to get consent right now. And you might need to get consent again when you switch over to the platform. So I really like the idea of communicating to parents, just telegraphing it a lot to say, it's okay, we're gonna ask you for consent now, and we're gonna ask you for consent later, because we really wanna make sure we're being very protective of student privacy. And at any point that any little minor change happens with student privacy, because obviously there's a different level of privacy that happens, or different privacy conditions that are set up when you're collecting information through your student information system versus when it happens through the online platform. We don't have to go into all those details in this meeting right now, but I think we can all conceptualize that, pardon me, they're just different considerations to be made when you're collecting it versus when the vendor is collecting information through a portal. And so just this idea that, it's going to be an ongoing process. And I also really liked what Dr. Kuchenberger said about, it also gives parents the opportunity to step out if they don't want to continue. There are multiple on-ramps and off-ramps. We want more on-ramps than off-ramps for sure, but having our parents consent at multiple times along the way is really our attempt to just maintain student privacy all throughout this process. So right now, the vendors either have or will have the ability to maintain consent and manage consent through that platform. So Project Beacon or Ginkgo are the primary two platforms that will be used across the state, and the ability to get consent for that, and the follow-up piece, consent for By Next Now being included in the overall of what you're doing, or if you're using a different type of follow-up testing, that's something that you will have to work out a little bit separately with your vendor, because our consent covers By Next Now as the follow-up test, not a separate PCR test. So if you are using a separate PCR test, just know that you're going to have to work on that piece of the consent with your vendor. The consent form that we're providing you covers pooled testing and follow-up testing with By Next Now, and all reporting to DPH for any results from By Next Now. Lauren, I know we're updating the consent form right now. I'll talk about that in a second on the next slide, but I know this is such an important piece and we're getting a lot of questions about it. Is there anything else that you want to make sure that we add here?
No, Russell, I think you have totally covered it. We are going to be updating our consent forms. They're not yet posted on our website, but they will be hopefully within the hour.
Great, thanks. And I'll just say a little bit more about updating those consent forms. I'll go here first. So we are updating the consent form. There is a new form that will be available today, like Lauren said, available on our website. It's just responsive to questions that we received, and our vendors know to use this going forward. And I really want to be clear about this. It doesn't require you to go back and repeat the consent form. If you have consent right now, you don't have to go back and get it again. But like I said, where consent has to be offered again as our vendors move towards the online platforms, that will be the consent that parents respond to then as well. So like Lauren said, more to come on that as we work our way through. And maybe on this slide, just some quick information about the vendor process for consent. So here are our three vendors up at the top, and we think about CIC. The way in which they're getting consent is either through Crush the Curve or Project Beacon. The follow-up testing is through Project Beacon. Follow-up PCR testing, if necessary, right? This is only when By Next Now doesn't pick up a positive result from follow-up testing, that CIC would use Project Beacon for a follow-up PCR test. There is, again, across the board, we're not if you're using PCR test instead of By Next Now, that's where none of the vendors have anything kind of built in for that yet. So that's where you'll have to work with them. And all of the consents for this, primarily go through Project Beacon, as you can see. Ginkgo, just following the same pattern, I won't read line by line, but you can just see that, where both pool testing and follow-up testing will occur will be on their platform. And keeping in mind that through February 22nd, we say paper, but we really mean, like that online student information system, some other way of collecting the information. It can be paper, but it also could be an online platform where parents give consent through February 22nd, and then going forward, that's where Ginkgo districts will join the Ginkgo platform so that all of the work becomes more automated. And then finally, as you can see, Project Beacon pretty clear across the board, really all through the Project Beacon platform. So we know there are questions about this. We're glad to work to answer them. And so I feel like I've been very wordy here. I hope you were able to take away some important messaging. And I think if nothing else, if you take nothing else away, just continuing to communicate to your parents that consent is probably an ongoing process as we roll out this initiative. It's not just a one-time event, and it's okay. So look forward to hearing any questions you might have, particularly when we get to the Q&A at the end, but just wanted to go over that important point with you. So we want to make sure that you're working directly with your vendor if you're having any trouble managing consent. And we've been really in touch with the vendors a lot around this issue so that they're being clear as well, because there was a lot to obviously sort through here. So the vendors are going to, because it's a little different, like we were just showing you on this slide, you'll be receiving a step-by-step document that outlines how you can manage consent. And then the vendors are available during their regularly scheduled office hours to talk about this further as well. So I hope that covers consent. That new form will be on our website today, and just glad to answer any questions that you have when we get to the Q&A session of this meeting. So a few policy updates, and really ask that you lean in on this because there could be some that are really relevant to you. There are some changes here. This is a good thing, as our understanding of COVID continues to change, and different levels of responsibility for things like the standing order. We're glad to bring you updated information, frankly, and to help make this all easier. So the standing order is our first place to begin on this. In the past, our messaging had been that a standing order had to be signed by a physician, and we're very pleased that now a standing order can be signed by a certified nurse practitioner. And so that is an update from the standing order for symptomatics by Next Now. Just to be really clear, you don't have to go back if you have a standing order. If it's signed, you don't have to go back and get anything changed. But we know there are some places where they're struggling to get a physician to sign a standing order, and hopefully this just opens up the cast a wider net in terms of who can actually sign a standing order to include certified nurse practitioners. And then we're getting examples of different places around the state where they're making some modifications to the standing order. And what we just want to make sure we're clear with people on is that if you change a standing order, it doesn't change what is already required through policy guidance. I would actually add kind of regulation or law. So for example, we don't want you to do this, but if you changed the standing order to say, how results will be reported, right? At the end of the day, all positive and all results have to go to DPH. When we do that follow-up testing, all results have to go to DPH one way or another. And so even if you change the standing order to say something different, it doesn't change your responsibility to do so. So we actually don't endorse or condone or encourage changing the standing order, but we are aware that it's happening. And so if this applies to you, just know that it doesn't change the existing requirements. Just please remember to keep those in place as we go forward. And your local board of health is certainly very well equipped in most cases to really help you understand what is non-negotiable in terms of particularly the COVID reporting process. This is big around the Buy Next Now test disposal. So up until now, we had said that all Buy Next Now materials had to be disposed of as biohazard waste, and that affectionately known as the red bag had to be used for Buy Next Now. And a good update from our colleagues at the Department of Public Health is that Buy Next Now tests are not considered medical or biological waste. So they can be included in regular solid waste trash. As long as it's not packaged or labeled as biohazard waste. And just as a good practice, we think that used swabs should be enclosed in a sealed Ziploc bag. We wouldn't want to just kind of leave them loose in the trash, but they are not biohazard. And we have had some concerns and some questions about setting up a contract for collection of biohazard waste or expanding a contract. And so this is, I think, good news, helps to facilitate the process. And it's news that's coupled with, the safety measures that we know that DPH is so very well aware of. And so this is done with a high degree of thought and consideration in making this happen. We are updating all of our documents. So you're not just hearing about any of the things that we're talking about, the standing order, the biohazard waste versus solid waste, is all being updated in any place where it appeared in previous documents, so that going forward, you don't have to just go back and look at this PowerPoint to find this information. You can go to the actual documents that you've been relying on and now see this change as we continue to move forward. We also wanted to clarify the PPE requirements for both administration and observation. And a lot of the reason why we're doing this is that I think people were getting confused between what counts as administration and what counts as observation. And the terms were beginning to be used a bit interchangeably across the state. And so we wanted to just kind of clarify a little bit better about who's doing what and who needs to wear what under those different conditions. So bear with me here, but the individual who is directly administering the swabs to collect specimens. So imagining that first grade class where the first graders are not able to self-swab. This is where an adult, a trained adult, needs to be administering the test, needs to be administering the swabbing. You can see the PPE requirements there in the right-hand column. In the second grade and up, where there can be this self-collection, keep in mind that that's an individual who's maybe coming into the classroom to observe and then take the final collection of specimens so that they can be kind of packaged up and couriered to the lab. So that individual needs to wear the PPE that you see on that right-hand column. Obviously, when we were talking this through, both the surgical mask and the gloves just make a lot of sense. That if you're the one touching the vial of swabs, it makes sense to wear gloves. So surgical mask and gloves, and then if it's possible, that person's still maintaining 6 feet of distance. So if we're imagining that students are self-swabbing and then kind of walking to a place in the class, or maybe doing the self-swabbing at a location in the classroom, blowing their nose, swabbing, and putting the specimen into the vial, that the observer is 6 feet away. But what I want to be clear about is that that's not the only way to do self-collection in a classroom. You could have somebody who is, walking around with a vial, for example, and your vendor can help you with these different options, because we know that there's probably not just one way of doing this. And so when I talk about maintaining 6 feet of distance, that's, when possible, when appropriate, but doesn't always have to be the way, because we want to make this kind of have as much flexibility with the collection of self swabs as possible. The assistance with pooled testing operations. So this is the person who's collecting and shipping the tubes. Again, they're touching the tubes, so we want to make sure they're wearing both a surgical mask and gloves. Nothing is aerosolized in this process, and so we don't need to worry about aerosolization, but just that extra precaution of having the surgical mask, having the gloves, just makes good sense. And then the final piece here is that there are other people in the room, and so there are staff and teachers in the room while for example, while test observation is happening, while self-swabbing is happening. And so they need to be wearing a mask. And particularly because students and other staff members will be taking their masks down for that period of time, we feel like it's important to maintain the 6 feet of physical distancing for those individuals. If you're the other staff in the room, that, in many places, the 6 feet of distance is the norm. In some places, it's not, because keeping in mind our guidance is 3 feet up to 6 feet, and so there are some places in the state where less than 6 feet are more common, and so just keeping in mind that the other people in the room just need to wear a mask and then work towards 6 feet of physical distancing for the people in the room at the time when the swabs are occurring. Hope that helps. So I've done a lot of talking here. I am glad to actually stop sharing my screen, and we're going to give control to our colleague Eliza Novik from the Shah Foundation, who will now take over, share her screen. Eliza, thanks so much for being here today. Shah, like I mentioned earlier, has really been working diligently to gather up really promising practices from across the state, bring them to you today, so that we don't all have to reinvent the wheel. What I love about the Shah team is they always say to us, if there's ingenuity, wherever there's ingenuity, it's to be found within districts. They are the ones who are able to figure these things out, and let's gather up what they're doing, catalog it, bring it to you so that you are able to get the information you need. Eliza, I'm done talking. I'm happy to turn it over to you. Thank you so much. Take us away.
Hi, everybody. I'm Eliza. I'm with the Shah Foundation, and I'm a project manager here. I've been working with districts and DESE and our team to try to bring you our brand new website, which we're super excited about. The website's designed to be a resource for districts as you plan and roll out your pooled testing programs. We know this is overwhelming. There's a lot of guidance floating around, and we know that you are the expert on your own district. So our goal is to give you the tools that you need to build a custom program that makes sense for your community. And we've tried to break down the process into bite-sized pieces to make it as manageable as possible. So to that end, we've organized our webpage into 3 sections. The first is Learn the Basics. This is kind of pooled testing 101. The next one is Getting Started, which has operational guides. And the third is our communications center, which has templates and examples for how to communicate with your various stakeholders, parents, families, staff, the community, et cetera. We also heard that districts wanted to see kind of a nose to tail model of like, what does testing look like in a school or in a district. So we have a case study on Watertown that you can check out that describes the whole process. We'd love to add to this section. So if you want to share your story, we would love to feature you as well. And then the last 2 things I want to point out here are our resource hub. This is where we store every example that appears across the site. So if you just want to see a running list, you can do that there. And then if you're someone who's like, look, I don't do websites, I just want a hard copy of a 25-page document that I can read top to bottom, you can download the whole toolkit here. This is what it looks like. It's all the content of the website just in one running document. So I'll show you around a little bit. In our Learn the Basics section, this is good if you are somebody who wants to start at the top. We have videos embedded in here. The way the website works is that each section has these tags at the top, so you can jump down the page to one of these individual sections, or you can just scroll down and read through. So we start with how and why to test. This is kind of background on pooled testing, why it's important, why it works. We have some visuals here. Any visual that you see is embedded as well, so you can download it as a document if you want to share it with your community. I want to point out our follow-up testing guide. So we have more details on this later on the site, but we know that follow-up testing is a big focus area for schools. So we go into this in more detail here. Then we cover a little bit kind of a week in the life, looking at the Watertown schools. This is an example. We talk about staffing logistics, who's where, when testing happens. Talk about the DESE program, which you all are now, I'm sure, totally experts on. And we talk about getting started. And then we have a template for a slide deck that you can use to introduce pooled testing to your community. You can download it, and I'll just show you what it looks like. It looks like this. The sections in yellow you can customize for your own district, but it takes you through what pooled testing is, and you could present this to a school committee, to parents, maybe your staff, and add custom content as you go. So at the bottom of each page, we put all of the examples and templates that are relevant. You can click around. Again, if you have an example that you'd like to add, please send it to us. We love seeing what other districts are doing. Moving into the getting started section, this section is definitely the longest, because for those of you who have started testing, you know that there's a lot to do. So we start off with a getting started checklist. You can use this as a guide to orient yourself. We have a link here where you can use it as a worksheet, or you can just scroll through the content on the web page. We do talk specifically about communications and consent in more detail. I'll come back to that. We go through the application process for the DESE program for those who are beginning the application process. We talk about identifying your testing team as well. We hear from districts that they're trying to wrap their heads around, who do I need to be doing what, where, and when. So we break this down into bite-sized pieces. And the idea is that you can look at kind of these quote unquote job descriptions for the different pieces at the district and school level, and then mix and match the responsibilities to make a staffing model that makes sense for your school. So this document here is linked in the website, and you can download that as well. Here's an example that comes from Watertown's case study of how they do their staffing. And we have other examples from Salem, Framingham. Some folks have hired externally for these roles, so you could check out their job descriptions. Again, follow-up testing we know is a hot topic. You can check out the guide for more information. We've gotten a lot of questions about scheduling. I know Russell talked about this earlier. We put together a worksheet that you can use. You can download this worksheet to start brainstorming how you might do scheduling for your different buildings. And then we have some tips to keep in mind about your testing schedule that will hopefully help you. And again, we have the Watertown case study example of how they've approached this. We've been getting a lot of questions about swab collection methods, especially for younger students with disabilities. So we've laid out some videos. Here's a super cute second grader showing you how he does his swab. We think this could be helpful for parents. And then we have some guides on how to help students with disabilities or younger students in particular. When it comes to swab collection, like where physically might this happen in the building, we have a couple of models to think about. I think we've talked about these in previous sessions as well, but we present them, kind of break them down, say how and why, and some rationale behind it. So you could adapt this for your own building. I know we talked about mobile testing carts. Here's an example of one in the wild. If you have a mobile testing cart you'd like to share with us, we'd love to feature it here as well. We talk about getting your pools to the lab. And then again, we have all of the templates and examples at the bottom. Finally, in our communications section, this is where we have been putting some templates around communicating with families, teachers, staff, and we show you some examples. So here we have some templates that you can download. I'm just going to show you what they look like as Word documents. So they look kind of similar to the PowerPoint. The information you might want to swap out is in yellow. You can download this as a Word document. We have a template email. And we also include a template text message, robocall, and social media posts. We have a similar template for communicating with school staff. You can check that out, customize it to whatever makes sense for your district. And then we have some key messages. So this is something we know is going to be different from other districts. Everyone's starting in a different place as far as remote, hybrid, concerns in the community, parent priorities, etc. So you can kind of pick and choose from these key messages to figure out what works best, adapt them to your own community. We have examples that are embedded. We know the school districts have been producing a lot of really great FAQ documents. So we've collated those here and tried to make those accessible as possible. We've also highlighted some direct communications that other schools have, or other communities rather, have used. So you can check those out. DESE's Family Communication Toolkit is linked here as well, which has a lot of great information in it. We talk about key messages for staff and teachers. Then we come to everyone's favorite topic, consent, and we try to make this as easy as possible. I know it's confusing, but we try to break it down here and provide some best practices, again, examples, and then I think you're probably getting the hang of it. At the bottom is where we have all of the examples that appear throughout the page, so you can access them in one place. So the last thing I want to point out on our page is our Facebook group, which I think is linked at the bottom. Yeah. We have a COVID-19 school testing Facebook group. It's new, but please join it. We were thinking it could be a forum through which school leaders, nurses, parents, or I guess probably not parents, but internal school leaders can discuss their programs, ask questions, share resources, etc. So that's the website. I'm going to end with two plugs, which are, we'd love to see your examples. So if you have a resource that you've developed and you want to send it to us, please do. We love seeing what schools come up with, and we will add it to our toolkit. This is a living, breathing document. Likewise, if you don't see what you need, or you use one of our resources and you're like, that didn't really work for me, let us know and we want to improve them. We want this to be as useful as possible. And then finally, if we're always here to help, we're here to talk. If you're not sure where to start, if you're feeling confused and you don't even know what your question is, reach out to us. Our contact information is in the deck that Russell has, and we'd be happy to talk about whatever it is that you're stuck on.
Great, Eliza. Thank you so much. I think I am so impressed by what you all have done and so grateful for it. And during the Q&A, if anybody wants to go back and have Eliza share or show again any part of that website, if you want to be kind of walking through, I was thinking particularly the scheduling. It might be if people want to see that in some more detail or hear some narration of that, don't hesitate to ask in the chat. I know that Eliza and the Shah team would be more than happy to kind of go back over any aspect of what a very comprehensive website like that has to offer. So thank you so much, and really look forward to delving in. Lauren, can you give me screen share again?
Does that work for you?
Oh, now it does. There we go. Here we go. Great. All right. So just to recap real quick on what we just saw from Shah, in the PowerPoint that we'll put in the chat and have online, just a reminder, and I appreciate Lauren putting this in the chat, repeatedly throughout Eliza's presentation, the website, the questions, and the Facebook community, all right there for you. And I hope you find those resources really useful. So thank you again. So just wrapping up with a few next steps, just a reminder that we continue to encourage districts to join on. We will accept matches through the week of March 1st. Just understanding that it does take a little while to get started with the training and the PPE that has to be put in place. And so if you join us by March 1st, you'll be able to get some benefit of this early launch by the end of March, when it's slated to end right now. If you haven't already done so, please apply for the implementation approval for Buy Next Now, and then complete the application and statement of assurances is the other important step to take. So the links are here. What two important steps to take: applying for Buy Next Now and applying for pooled testing through the authorized school application and statement of assurances. So kind of two separate things. I'm hearing from my team that some people are, wanting to get everything done through, for example, applying for pooled testing and not realizing that they also have to apply for Buy Next Now approval. And so just keep in mind, it is a two-step process. So that's it for me. Lauren, I'm really glad to go to any questions and anything that my colleagues from Shah or the COVID Command Center want to underscore. Certainly welcome their input as well.
Great. So there were a fair amount of questions regarding consent. And so Russell, if you could just flip back to the slide about consent. Just a reminder for people, we will be updating our forms and they will be posted on our pool testing website. And so please check back for that. There were some questions about, is the DESE form different than what the vendors are going to be using or are using in their system? And no, the forms are the same. So if you are getting consent through your vendor, great. If you are getting consent using our paper forms, they are and should be identical. And and they will be translated in other languages and posted to our website. Eliza, these questions are for you regarding implementation, wondering about biggest challenges with reflex testing. And so if you could just review very quickly some of the resources that the website provides as it relates to reflex or follow-up testing.
Yeah, definitely. Now all my windows are out of whack. But the website in our getting started section has a description of like what the different options for follow-up testing are, and then examples of how other schools have approached it. So this is a combination of schools doing Binax only, a combination of Binax and individual PCR, and individual PCR only. And it walks through the different testing options. And then the other consideration is where and how do we actually do the testing? Is this, do we bring students back to school? Do we have a central testing hub? Do we create a network? So we offer different examples of where the testing can happen. So between those two, we hope that you can kind of piece together the best solution for you.
Great, thank you. There are some questions with if districts have questions that their vendors are unable to answer, who should they go to? And so we definitely recommend that you email the K-12 COVID-19 testing email address. And I can put that right in the chat for everyone, or Russell, is there a slide that has that? If you are having any issues at all with your testing vendor, either there's a question that was just not clear, or if you just have a specific question about the operations, please reach out to us and we will help to facilitate that relationship and make sure that your needs are being met. So again, that email address is K-12 COVID-19 testing at mass.gov. Jeremiah, could you review the changes that are being made to the standing order? And Russell, if you could just flip to that slide.
There we go. Thank you. Yeah, the biggest change here is that the standing order used to read that only a licensed physician could sign that form. And the change that's being made now is that a licensed physician can sign that form, but a certified nurse practitioner can also sign that form. So that's something where we're expanding who can authorize the standing order. And that's the reason why, if you've already done a standing order for the pool testing, you don't need to go back and change it at all. And sorry, I can cover the second piece, Lauren, if it seemed like there were questions about that as well.
That would be great.
Sure. So the second thing on this slide is just meant to reflect that if you have details about how the testing program is going to work, I think mostly logistically at your school, that is certainly something that you can write into the standing order. Again, really, as long as it's fine with the person who's signing it. What we want to be very careful about is schools who change the standing order to reflect a different practice than has been issued as guidance by DESE or DPH, or as policy by DESE or DPH. For example, a standing order that removed the need to report individual test results on Binax. Just because you change that in the standing order doesn't remove the obligation to report all of those results.
Great. There are some very specific questions around implementation, both for pool testing and thinking about cohorts and groups, and also reflex testing. So again, Russell, could you flip back to the Shah slide, which has their resources, their website address? For specific questions related to implementation, we definitely recommend that you go to this website here, the covidedtesting.com, and look at the resources that have been compiled. Also, feel free to email the Shah Foundation directly, and they can provide some technical assistance and take your specific context and provide you with some recommendations. So I think that concludes most of the substantive questions that are in our chat, Russell.
Great. Thanks, Lauren. And thanks everyone for being here. I hope that you found this helpful to give you some new information, particularly the Shah website. I hope you will find very useful. I really appreciate how many reusable materials there are there as you are working to communicate this out to your stakeholders. So really let us know what else you need. Let us know your reaction to everything that DESE or Health and Human Services or Shah has prepared for you. We only want to make this better, easier, more facile to implement. So please keep your questions coming. We will follow up kind of periodically with meetings like this again, just to keep you informed and to bring us all together around this important topic. So I hope you have a good rest of the week, a very good vacation week, and we'll be back together later in February. Take good care, everyone.